My name is Ryan Fragapane. I'm a project manager at AASHTO, and I want to welcome everybody to the AASHTO Air Safety webinar today on vulnerable roadway users and Georgia DOT's use of the Social Vulnerability Index. I think we have a great webinar today with Jerry Roche from Federal Highway Administration, as well as Dave Adams with the Georgia Department of Transportation. So I'm very excited to get started here. I do want to go over a few housekeeping items before we get underway, though. As you probably have realized when you joined, everyone is muted for now. This is because we are recording this webinar. So the webinar will be recorded, and we'll provide that recording later on this afternoon or tomorrow morning. It'll be linked to our website, and we'll send an email out to everyone to make sure everyone has access to it, and you can pass it along and share it with your colleagues. Additionally, since we have everyone muted, just for clarity of the recording, I ask that if you have any questions or comments, you please put them in the Q&A box located on the bottom of the screen. We'll answer those as they come up. What we'll do is we'll try to save the questions for the end, and then we'll try to answer them in person at the end. If we don't get to them, we will type you a message up. And anything, we have about 90 minutes today. We're going to try to stay to that 90 minutes. So any questions that happen to run over, please put them in, and then we'll respond to you via email at the end. Additionally, if you do want to have some follow-up conversation, we will be unmuting people at the end when we do the Q&A, so we can ask questions in person as well. So with that, I'm very excited to get started, so I'll hand it over to Greg Olson with Numetric.
Awesome. Thanks, Ryan. Well, I will be really brief because we've got a great presentation in store for you guys today. Really quick, just want to kind of do some quick introductions here, run through the agenda. As Ryan mentioned, we're going to hear from Jerry Roche and Dave Adams here in just a minute, talking about social vulnerability and vulnerable road users. We do have some time at the end reserved for questions. Just to reiterate what Ryan said, as we're going through that presentation, I would encourage you guys to drop those questions in real time in the Q&A window. Don't wait for the Q&A session at the end. If there's a very relevant question that comes through, we may just kind of, interrupt Jerry and Dave really quick and just ask them that clarifying question while we're on that topic. So please feel free to drop in there and ask those questions as we're going through that presentation. We have plenty of time usually at the end to address all the rest of the questions that come in through the Q&A as well. So again, I'd encourage you to kind of do that. I'll keep an eye on that through the whole presentation, and we'll kind of administer that way. We've got a lot of great information here. Really quick introduction to our presenters. If you've attended any of our webinars in the past, you probably know Jerry and Dave, but they are some great people that we've had the pleasure of working with for quite a while now in Georgia and in other states with Jerry. But Jerry Roche is the team leader of the safety integration team in the FHWA Office of Safety. Jerry's been with the FHWA for quite a while now, and is really been a great partner like I said, we worked with him really closely in Georgia. He's always got some great insight that he's going to share with us today. Also, our second presenter after Jerry, we're going to hear from Dave Adams. Dave is the State Safety Program Manager for the Georgia Department of Transportation. Dave has been a user of AASHTO Air Safety and Numetric for quite some time as well, and has been doing great work in Georgia with their local road safety programs, as well as just sharing data throughout the state of Georgia. So they've really done some amazing stuff and are really improving their roadways down there in Georgia. So Dave's going to share a little information on how they're specifically focusing on social vulnerability. But like I said, I want to save the rest of the time. No one came here to listen to me, so I want to save the rest of the time and kick it over to these guys. We're going to start with Jerry, and Jerry's going to talk to us a little bit about those vulnerable road, kind of a deeper dive into that vulnerable roadway user information, help us understand, what that means, what those requirements are, and kind of, a really great overview of that program. After Jerry, we're going to kick it over to Dave, and Dave's going to talk a little bit about how Georgia specifically has been using vulnerable roadway user data with their crash data and actually helping it to make informed decisions. So Jerry, we'll go ahead and kick it over to you here. I'll stop sharing my screen.
All right. It's
There you
like
go.
I share mine. So, okay, I will do that. All right. Thanks for the opportunity today. I appreciate having that the opportunity. It looks like you've got a great attendance list. So happy to be with you guys today and to share a little bit more about the VRU safety assessments. I'm guessing a lot of the folks on this call may have more of a data inclination, which is my background as well. I certainly consider myself a safety data analyst or an engineer, as I like to call myself. Excited to kind of dive into that part of this effort. If you are in that data realm, I'm guessing you've heard from others in your agency, certainly your safety office, as they work to meet the requirements of the vulnerable road user safety assessment. And so I just want to walk through the guidance, just give you a little more background on that. If you've seen in some of my presentations in the past, or anyone really from Federal Highway Administration, there's usually a disclaimer that's included. And it says, except for any statutes or regulations cited, the contents of this presentation do not have the force and the effect of law and are not meant to bind the states or the public in any way. This presentation is intended only to provide information regarding the existing requirements under the law or agency policies. So we are going to talk a lot about regulations and statutes today. This requirement, the vulnerable road user safety assessment, was included in the bipartisan infrastructure law. And so states have, in their local agencies, have been scrambling to work on this year. So our guidance came out in, I'll say, mid to late October, and the requirements are coming up soon here in mid-November. So just to start off with some definitions, I want to make sure we covered this, and there has been some confusion on this a little bit. The vulnerable road user is a non-motorist with a FARS person attribute code for pedestrian, bicyclist, other cyclists, and persons on personal conveyance. Personal conveyance means wheelchair, skateboard, those kind of things. Or an injured person that is equivalent to a pedestrian or pedocyclist as defined in ANSI D16. So, what we commonly use, we'll talk about folks or people walking, biking, or rolling. This does include highway workers on foot within a work zone, given that they're considered a pedestrian. And so I'll certainly mention that this is National Work Zone Safety Awareness Week. Be sure to wear orange tomorrow, but I want to make sure we mention that is included as a pedestrian. This does not include motorcyclists, however. So if you see some of the definitions that NHTSA uses, sometimes motorcyclists are included in that vulnerable road user category, but in bill, it talks about the requirements. So the definition I gave here is what we expect to be used in the guidance. So the term vulnerable road user safety assessment means assessment of the safety performance of the state with respect to vulnerable road users and the plan of the state to improve the safety of vulnerable road users. So I think that's the only definitions I've got. So the rest of this should be pretty free flowing. So unfortunately, as you see the slide here, we've got an increase in vulnerable road user fatalities that has been going up over the last decade. And I don't have the 2021 or 2022 estimates on this slide, but those have gone up as well. I think pedestrians were up, we went up 13% from 2020 fatalities, and then another 2% in 2022. So for bicyclists, we're up 5% in 2021 and 8% in 2022. So the early estimates for 2022 fatalities shows a leveling off. We certainly didn't decrease, but they think it's going to stay about the same. But we did not see that for our VRU fatalities. So those continue to increase, and something that keeps us concerned. So when you look at this from an equity perspective, we also see some disenfranchisement a little bit here, and certainly those that are disadvantaged are seeing a bigger percentage of these fatalities. And so equity we see as a very big component to the VRU safety assessment, and looking at some of those areas that have been disadvantaged from a transportation perspective in the past. And I'll just give you a little overview of the guidance. We'll talk about just the schedule and frequency of the updates. We'll get into the requirements, particularly the data-driven process. I want to certainly touch on that quite a bit today. We'll also talk about consultation and what's necessary there. And then look a little bit at the funding opportunities and then how this might tie into some of your other efforts within your safety offices. So schedule and frequency, the most important one here is that first bullet. The initial assessment must be completed by November 15th of 2023. Please work with your division offices. If you think that's going to be a challenge or you're experiencing some challenges, let us know. Reach out to the division office. We also have the ability to provide some technical assistance if your state requires some. If there's some things you need help with, please reach out. We'd love to have that communication early and as often as necessary. So once the initial assessment is done by November 15th, then the subsequent updates will be done as part of the SHSP updates. And so it'll actually be an attachment or a portion of the SHSP going forward. So we'll talk more about that as we get into some of the requirements here. Just the requirements from a data-driven process, the state must perform a quantitative analysis of the vulnerable user fatalities and serious injuries, which includes data such as location, roadway functional classification, design speed, speed limit, and time of day. It needs to consider demographics of the locations of fatalities and serious injuries, including race, ethnicity, income, and age. And based on the data, identifies areas as high risk to vulnerable road users. So we'll get into that a little bit more here, and certainly encourage your questions as you go through that. So when you get into the data section, and we'll talk about using the most recent 5-year period of which data is available. So that does not have to be, you don't have to match the FARS data, which is always lagging behind. If your state has more up-to-date information, you certainly can use that. And if your state is struggling, then use the most recent 5 years that you do have available to you. So we talk about what that might mean as far as just examples of the data you'd want to include. We certainly do recommend that you give consideration to tribal areas. We know that's another area that's overrepresented in fatalities for VRUs. And then also that you work with other agencies to obtain additional data. In some cases, you may have cities that have exposure data for pedestrian and bicyclists. That's something that's usually not available at the state level, but might be at the city level. There may be other data that is available. We certainly know in some cases that hospital data has been very useful for agencies to get a more full picture of what's going on with VRU fatalities and serious injuries. So certainly think about the other data that might be available to you. As far as demographics data, that's something that is sort of new, I think, in the safety analysis realm, but we certainly know that there's opportunities to do more there. So we do encourage the states to also use demographics of people that are killed in all traffic crashes. It wouldn't just be the VRU fatalities and serious injuries, but certainly those things. And we did list a number of demographic data sources that are out there. There's a number of sources sort of on the public health side, or even from Federal Highway Administration and USDOT. And then I think we're going to have Dave talk about the SVI, the Social Vulnerability Index that comes from the CDC and how that's been integrated into the AASHTO Aware Safety tool. So I think that's a great source for agencies to use.
Hey, Jerry.
Go ahead.
Sorry to interrupt. We had a question about the data availability. The question was, you were talking about the 5 years of data. Is that, are they able to use more than 5 years of data? So if they have like 10 years of data available, is that something they'd be able to use, or should they keep it restricted to that 5-year period?
I think we're interested in that 5-year period for sure. If you do have 10 years, if you wanted to use that as supplemental information, if you wanted to see if the trends have changed, that's certainly something you could do. But we're very much interested in that 5 years. We want enough data that we have, long enough portion for those issues to arise. If you have a frequency based analysis that you're looking at, we need at least probably 5 years just to have enough crashes that have occurred to really make heads or tails of the data. If you get to 10 years, there can be so much change over a 10-year period as far as land use and development and vehicles. And so I'd be a little concerned that at 10 years, that might be a challenge. But, if you were in a scenario where you don't see enough crashes from a 5-year standpoint and you want to look at 10 years, that's something we could talk about. Certainly work through your division office, and we can maybe provide a little more detailed assistance in that case. So
perfect. Thanks, Jerry.
Thanks. Great question too. Keep them coming. So As far as the high risk areas, that methodology can be your own on how you identify that. I know a number of states are talking about just adapting some of their existing approaches. So some agencies have done high injury networks, or they've done a predictive safety analysis. Maybe they've done a systemic safety analysis. Systemic analysis certainly works very good for VRU fatalities, which tend to move all over the place, and so that can be a good approach. So the approach is really up to the state to decide. We can provide some assistance. We can provide some noteworthy practices if you're struggling with that. We certainly have a list of data tools that you might use, but AASHTO or Safety, I know, can do some of these things for you. So it might be something to consider. We also listed some of the high-risk areas you might look at, MPO regions, or it's at the county level, maybe it's at the city level. Maybe you identify different facility types. We certainly know arterials are overrepresented in VRU fatalities, particularly the high-speed fatalities. And so one of the things that we've seen, at least at the national level, is a lot of times it's these arterials, probably state-owned arterials, that as they come into a community, there's changes in design, but a lot of times the speed maybe has not dropped down. The drivers are still driving, 50 miles an hour plus as they start to enter these suburban or urban areas. And that's where we seem to have a challenge. The speeds haven't dropped in the vehicles. They maybe haven't perceived the need to slow down yet, but we've had an increase in pedestrian and bicycle activity because it is more of a in the community center, right? And so that can be an area that you might look at. It's certainly your arterials. It could be corridors or intersections you've identified, and it could even be priority areas. I mentioned work zones as an area that you might think about. Like I said, it depends on the state. I know some states are thinking, hey, we're not going to look at our freeway system because pedestrians and bicyclists aren't allowed on our freeways. I've heard from some states, they're saying, hey, we are going to include the freeway system because we have a number of fatal and serious injury crashes that occur while pedestrians are on the side of the road, if they're repairing a vehicle that's broken down or what have you. And so it could be something that you decide to include or not include. And certainly your approaches can be different too. They could be, you might be doing some things in urban areas, and maybe you're doing something for rural freeways where you've seen issues. So that's really up to you. There is a requirement that states consider the safe system approach, and so just include a little bit of information on that. I think to me, the two main areas where you could get into the safe system approach is really anticipating human error and how we sort of solve that issue. We all make mistakes as drivers, as pedestrians, as bicyclists. We've probably all made mistakes ourselves. And so the way we can sort of mitigate that is to separate users in space, right? If you can separate them in space, maybe you're using roundabouts, or you've put in a protected bike lane, you're helping separate those users in space. You can also separate users in time, things like roundabouts, or in this scenario on the screen here, you've got the rectangular rapid flashing beacons to help get vehicles to stop and yield to the pedestrians as they cross. So you're helping separate them in time. You can also increase attentiveness and awareness like those RRFBs can do. So the other one we want to really go after is accommodating human injury tolerance, right? And so maybe we can't reconfigure the roadway. Maybe there's no opportunity right now for us to change the intersection configuration. Well, one of the things we can do somewhat easier is reduce those speeds to something that's more tolerable. And so look at reducing those speed limits, particularly in suburban or urban areas. Is there an opportunity to reduce those? There are certainly things like speed safety cameras that are becoming more and more popular for, at least for certain areas, school zones, work zones. We've seen agencies even use those on rural freeway sections that they're having challenges with speed. So something to think about there. We also require consultation. That says states are required to consult with local governments, MPOs, and regional transportation planning organizations that represent a high-risk area. So at the very least, once you've identified sort of those high-risk areas, we expect some consultation with those communities or those agencies to have a conversation. There might even be benefit to consult them early in the process. They may, like I said earlier, they may have data sources that might be helpful to you. They may have some things already in the works that you'd want to know about, and some opportunities to partner on some projects. And so, consultation does not mean, finishing your assessment and sending them a copy, right? It certainly means engaging with them, particularly on those high risk areas, to identify potential solutions. Things that the local agency would support, that might be options. again, there's probably a lot of things already happening in that area. And so consultation is certainly helpful. It might help too, road safety audits is another opportunity for consultation. You maybe have already done some road safety audits. And again, this might be a chance to further take the results of those audits and actually implement some of the improvements that have been noticed or identified. So certainly in your planning processes too is another opportunity. So as I mentioned earlier, we certainly recommend engagement with tribal governments. I think that can be very helpful. And also your advocacy or community groups. It's a lot of times they have information that can be very helpful. And so it's another group you can work with that help get support on your side as well as you're looking at solutions. So certainly encourage you to involve them. And the requirements also talk about a program of projects or strategies. It says that it shall include a program of projects or strategies to reduce safety risks to vulnerable road users in areas identified as high risk. So you have to consider the outcomes of that consultation and as well as the safe system approach as you do that. And so the program of projects, especially this first time around, we don't expect, you have very specific projects where you've identified the solution already and have a cost estimate and that kind of thing, right? A lot of times these VRU type projects could be very urban areas. There's utility accommodation, there's right-of-way restrictions a lot of times. And so certainly we expect a list of strategies, but also if you could start looking at potential projects or identifying sites. Maybe you don't know exactly what you're going to do there, but you've identified corridors that may need some sort of further look to identify specific solutions to those. So that's an opportunity there. There is also a requirement or a note in there that the program of projects may not degrade transportation system access for vulnerable road users. And so what that really means is that you cannot try to restrict access for a VRU group. So, your solution can't be to put up a big fence, right, along the sides of the roadway. That's not an acceptable solution if we're restricting or reducing access that already exists. And so, but we do also encourage you to look at other things that you already have in the work. A lot of states are starting to look at complete streets already. There may be ADA transition plans as you're looking to add curb ramps or improve your pedestrian accommodation. Access to transit is another area to really look at. That's where we see a concentration a lot of times because we've got bicyclists and pedestrians that are using transit to get to work, to get to their appointments. And so that's something you want to make sure you accommodate, making sure those bus stops or rail stops are as safe as possible. So I would certainly encourage you to look at the proven safety countermeasures, oftentimes low cost safety treatments that allow you to treat a large portion of your system. So these don't have to be very expensive projects all the time. So looking at funding opportunities, there are two programs that we've identified, federal programs that can help you conduct your assessment. The HSIP program does allow the state to spend a percentage of their funds for assessments or data analysis, as does the SP&R program, the State Planning and Research Program. So when you start to look at implementation of these projects, there's a whole host of things. Certainly these projects would be eligible for the Highway Safety Improvement Program. A number of states are what we call fit underneath the Vulnerable Road User Special Rule. What that rule says is that if your state experiences 15% more of your fatalities as VRU fatalities, then 15% of your HSIP apportionment must be spent on improvements for vulnerable road users. And so that's an opportunity. Certainly, if you've done the assessment, plus you're under that restriction, that should fit together really well. Safe Streets and Roads for All is certainly another opportunity for you. I think I heard Emily Schoeniger at USDOT or the Office of the Secretary mention a few weeks ago that 90% of our SS4A projects that have gone forward so far have a pedestrian component, and 80% of them had a bicycle component. So certainly a good portion or a good program to look at if you're looking for funds to improve these locations. Reconnecting communities also is an opportunity. Surface transportation block grants, the Transportation Alternatives Program. There's also a transit flex. You can actually move highway funding over to transit, and transit can move money over to highway to help make improvements for VRUs in and around transit stops. And then there's other federal aid programs as well. So I did include a link there. It's quite a robust matrix that show all the different funding sources that might be something that a state could use to implement some of the projects. So we certainly, go ahead.
Sorry.
No.
Get another question. Does VRU reset or research project funding count toward the VRU special rule?
That I would have to look at.
Okay.
I'm not sure if that would meet the requirement. So maybe that's something we can you could talk to me offline, and we can certainly look into it, or work through your division office too. But I don't know off the top of my head if that counts or not.
Okay.
So we can certainly look into that.
Awesome. Thanks, Jerry.
Yep, great question. Just some of the other activities your agency may already be engaged in that you might want to connect to. Certainly your SHSP or your related action plans. That could meet the requirements on your vulnerable road user safety assessment if it meets all of the requirements. So some states may have done like a pedestrian safety action plan. Maybe you've done a pedestrian and bicyclist safety action plan. So that could meet all or some of your requirements in that plan. HSIP implementation plans, states that haven't made significant progress towards their safety performance goals are required to develop an HSI implementation plan that potentially could have a VRU component to it, right? That might be where you're seeing your challenges, and so maybe you've already done that. If so, that would meet the requirement. I also mentioned the HSIP reports. That certainly requires you to reflect all of your projects that or strategies that you're implementing. So if you do fund some projects from your VRU safety assessment, we would expect those to be included in your HSIP report. And then also your agencies, your local agencies or MPOs may have already done a safety plan of some type. And so that's something you should consider as well. They may have already, you might identify some MPO areas or cities that are high-risk areas. Maybe there's already a plan that exists that deal with that VRU safety assessment, or at least a portion of that plan. So again, one of those reasons that consultation will be key. There might be some great things. There's no need to recreate the wheel if you've already done some of those things. So there is a very basic template that is included in the VRU safety assessment guidance, and I'll have a slide here in just a second that kind of shows you it's not much. This kind of gives you a paragraph on each one of those areas, but kind of helps you a little bit farther down the road about what's expected in those sections. So here's a slide that, and I can provide the slides as in the chat, or I can send them to you, Ryan, if you want to disseminate them. But the first one there gets you to the guidance and the template. The second two are webinars that we did. The second webinar just walks through the guidance. And the third one was actually 3 state examples. We heard from Iowa, Texas, and North Carolina about how they're starting to meet the requirements. A lot of what we were talking about were noteworthy practices that were done in advance of the VRU safety assessment requirement, but they talk about what they've been doing and how they're modifying that to as a portion of the VRU safety assessment response. So that could be very useful to you as well. So, and I think that's what I've got. I will go ahead and stop sharing. If there's more questions, Greg, we can take them now. We certainly can wait till after Dave's presentation. I'm excited to see what Dave has to say and learn more about what they've been doing there in Georgia. So,
no, perfect. Thanks, Jerry. We did have a couple more questions come in. We'll save those for the Q&A. We'll send them over to you right now in the chat so you can kind of get prepared for them. But we'll
good.
Thanks, Jerry. Great information, and thanks for hopping in and answering those questions as well. All right, Dave, if you're ready, we'll go ahead and kick it over to you, and you can walk us through what Georgia is doing specifically related to vulnerable roadway data. Dave?
I had to unmute myself.
There we
Sorry
go.
about this.
We got you.
You do see my screen. Okay,
Yeah,
that's
we got
good.
the map up.
I'm not nearly as polished as Jerry. I think that's why he's got that big FHWA job. So hopefully everybody there will excuse me and understand that, I'm just a nerd sitting in a basement. So but before we get started, I want to talk a little bit about where Georgia was just 3 years ago and why this particular subject would have been very challenging for the state, and why we sort of have gone down the path we've gone. 3 years ago, we were very dependent upon our districts to bring projects to us. Essentially, we would send out a request for project locations or ideas for us to study. They would in turn coordinate with local governments to say, hey, do you have any areas or something like that that may be of concern? And of course, the planning process works very much like that too, a little bit differently. That's not my area of expertise. So I'm just going to focus more on the HSIP, SHSP side of the house. So when we would do that, we would get a list of projects back, and then we would do basically a safety screening or a crash screening, however you want to refer to that. So it wasn't truly initially data driven from the onset. It's sort of like a biased data driven. In other words, where those locals said, hey, we've got a problem here, we would then do a safety screening, pull the crashes. We've still got a database where we could pull crash data reports from. We'd then say we have these reports and we think these countermeasures would be good. And then we would turn around and do a rough estimate of what those would cost and calculate a benefit cost. And then within our system, and as it is today, each one of those projects based on benefit cost for the most part would compete with one another with each one of those specific funding areas within our HSSP, HSIP. So in other words, pedestrian group, the pedestrian related projects would compete with one another. Our our off-system safety program, those projects would compete against one another. So you can sort of see that that's how it worked, but there's always that initial sort of bias where the local person would say, I think I've got a problem here. And we've all probably had that experience where a mayor calls up and says, we've got this horrible intersection where we've got all these crashes. True, that's a great concern, and we want that feedback. But we also want to be able to evaluate that feedback based upon the full network. So 3 years ago, we started working with the Numetric team and saying, hey, we've seen your solution that you've built for some other states, and we want to try that in Georgia. So we've found a very good partnership. But then now what we found is we've been asked to this additional question, and we need to find a resource so we can consider the impacts of these underserved communities and how that affects these vulnerable road users. There's a good correlation.
Hey, Dave.
Yeah.
I'm sorry. We're currently looking at your Google Earth map. Is that the screen that we should be looking at, or is there a presentation?
Well, let me drag it over. I thought you could see my presentation.
Oh, sorry. No, we were looking at the Google Earth map, and I thought that was what you were walking us through.
Is that it?
There we go.
Oh, now it pops up, and now it should pop up now.
We're looking at the presenter view right now.
The presenter view. See, this is why I stink at this.
You're
Hold
good.
on.
You're
Dave,
good.
if you go up to the display settings at the top, pull that down and swap screens.
Okay, hold on one second. Display settings, swap screens. Hold on one second. At the
It's right above your. It's right where your mouse was.
that. Nope.
Right of the green part that you want.
Just point me to it. I can either.
Can you
I
see
can-
that right there?
There you
Okay, let me sort of close that off real quick. Let me stop sharing real quick. And I bet, I don't know why it did that. If I do this, what do you see now?
Yeah.
go. That's the thing.
Still there. So now with your mouse, just move it up on the page up to the left.
Sorry.
Nope, you're good.
I'll tell you what I'll do. What do you see right now?
We see the PowerPoint deck.
The PowerPoint deck. I'll just do it from this. And I can still do this. I can just do it. Now, do you see the title screen, title page?
Nope. If you just move your cursor up right from where it's at now and go to display settings,
Go.
right there.
I
Yep.
got you. I'm looking. I wasn't looking
There you
down at
go.
my laptop.
And then swap presenter view and slide view. Perfect. There you go. Sorry,
Okay.
Dave.
No,
There you
that's my bad. I guess we should have practiced this, right?
You're good. You're good. Keep going.
Okay. So, well, I got through all that, and sorry for that malfunction there, folks. Hopefully you won't contact my supervisors and tell them how painful that was. But basically, then we came with this process. Now, given our old process that I described, and now we're working in a new metric application, from AASHTO, we were able to do this, and we were able to move into this and do this analysis of considering various sources to identify underserved communities and potentially test their correlation between vulnerable road users. So we collaborated with several parties and several individuals, included advocacies and things like that, to basically get input into what sources we should be considering. And as we went through these conversations, we were sort of introduced to the CDC's vulnerable or sociable vulnerability index, the SVI. Now, I'd never heard about this until this had come about. We're talking to a couple of groups, different groups, and we finally said, well, let's look into this. The one thing about it is what we were initially concerned about was, well, this is designed for, to basically serve because of hazardous environmental hazards like hurricanes and tornadoes and flooding. And so we want to say, do you think this is really going to be a good fit? So we went in there and we started looking at it, and we said, hey, there's some pretty relevant features, and they're doing some pretty relevant analysis. So maybe we ought to dig into this easier. But what we also noticed when we looked at it, it had a very simple rating system from 0 to not low vulnerability to a 1, which is high vulnerability. So you basically got a 0 to 1, very digestible. So any user, it's not just, was it good for us, but I'm thinking about the users that we share our applications with within Georgia and outside of Georgia, our MPOs, our local governments. And I said, hey, if this works, this is something they can pretty much wrap your head around. A 0.9 is pretty bad, where a 0.09 is not very bad. So I said, might be usable, but first we need to look at this a little bit closer. So when we started talking to folks about using this, considering the strategic highway safety plan, we worked within that organization, and we worked with various task teams within the strategic highway team. And we worked with our pedestrian task team, our codes task team, and our data task team. And we said, hey, we want you to take a look at this and give us your feedback. So first off, we weren't operating within a vacuum. In other words, this wasn't just David's little idea. We wanted them to perform some analysis, study this. So we worked with them very closely, and we tested the relationship between SVI and vulnerable road users using various analytical methods. And the big footnote on this is that all the methods showed a statistically significant positive correlation. So in other words, a high SVI score also indicated a high probability of vulnerable road users would come in contact with vehicles, or vehicles would come in contact with them in a bad way. So we said, we might be onto something here. So they completed that study. I can give you a link to that. I didn't include it as part of the slide deck. I didn't want to get into that study or anything, but it was a very good study. It's just for the state of Georgia. It may not apply to your state or to your county or to your region, but for the state of Georgia, we got very positive results. What we also liked about it, when we looked at social vulnerability index, we said, wow, it's broken down in these 4 primary categories. So Jerry already got into this when he was talking about his slide. I think it was slide number 8. Jerry, I can't remember, but you talked about these very specific items: socioeconomic status, ethnic status, household, transportation, and housing types. These were part of what Jerry just already, and it was a great fit. So I'm sitting there going, hey, we might be onto something. But then they also have got this overall score, which basically takes all 4 of those categories and creates an overall score. on the same scale, 0 to 1. So the user can either apply individual sections of this, or they can apply the overall score in any of their filtering criteria. So when we think about that, is how would we use this within Numetric? Can we get this into the Numetric application, and can we make this accessible? Because we know at GDOT we want to somehow figure out how to answer these questions, but we also know local governments and MPOs are going to want to be able to answer these questions as well. So when we first started doing this, we took all of our crash data and we say it falls within one of these census tracts. So another nice thing about SVI, it's based on census tracts, or it's at the county level. We wanted it at a more granular level. We wanted it at the census tract data level. So we downloaded, so you can go out to the website for free, download the data, and then you got it and we worked in a ArcGIS environment, and we simply applied the census tract scores to each one, for each of those 5 measures that we just covered. And we applied each of those 5 scores to each crash. So we were able to basically define each one of those crashes by score. And we wound up with a grouped and an ungrouped. So you can set greater than or equal to the entire list, or you can look at things at the group level. But basically what we're looking at in this table right here, very simple, is the percentage of crashes that fall into those grouped levels. So when we're looking at this table that's to the right, very simple, 11.61% of our crashes fall in the grouped level of 0.06 to 0.07. Pretty simple. So it set us up for, what I think it did is it set us up for something that's easily understandable, easily shareable, but it also allows us an easy way to find vulnerable areas where vulnerable road users are using our app, could be potentially at greater risk on our roads and highways than in other areas where there's lower vulnerability scores. And we thought we think that we're onto something pretty good. With all of that said, we still don't have really a way defined definitively on how we're going to use this for the assessment. We know we're going to incorporate it somehow. So anything I'm suggesting here is not indoctrinated in the state of Georgia yet or anything of that nature, but we are starting to use it, for instance, in how we potentially locate road safety audits, for example. So I want to take you through a couple of slides that sort of lay out how social vulnerability index can be used to help identify road safety audit locations that have a higher probability of incorporating vulnerable road users, risk to them within those footprints. So all these acronyms really tongue tie me sometimes. I apologize. But real quickly here, using the tool of sliding window analysis. Now, I don't know how many people on the call use the Numetric applications and how many do not. So I'm going to talk as if most of you may not have a sound knowledge or have used the application before. So hopefully those that are accustomed to using the application won't find this too dry. What's really nice that we like about the sliding window analysis is it has tools to allow you to set up your window first. Because when you consider consider your program capacity and your capabilities, when you think about your window, your sliding window size, do you have the resources to build projects or to make changes over a 1 mile section, over a half-mile section, whatever that might be? And, how do you want to go about doing that with local forces, with your forces, with contracted forces? So all of those things can be considered, and that also can be considered when setting up your window size. Also, your roadways. Are you looking at state route systems or federal route systems, which you might consider longer roadway sections, or you consider in city streets, which a lot of city streets are quite short in length. So you might want to set up shorter sections. So when you set up your window length, consider those things and take those into consideration. In this particular slide that you're looking at, I set up my window at a half mile. I said, I'm looking at half a mile, but also did sort of a scenario like I got contacted by the Athens area MPO. And I said, so first thing I do is I define the geographical boundary and said, hey, I'm going to go in there and I'm going to define a geographical boundary for my road safety audit. We're going to go to the Athens MPO. They've asked us to help locate some areas within their MPO boundary that would make good road safety audits. So set up a half mile window, define my boundary. Now apply my social vulnerability index. So I apply 2 social vulnerability indexes, 0.9 to 1 and 0.8 to 0.9. Now I could have done just the greater than 0.8, but I just set up the 2 units. But then because Georgia is a towards zero state, we have a Vision Zero goal. I also filtered down to K, A, and B severity crashes. The reason why I did that is I didn't want a lot of simple, I hate to say it like this, a lot of simple PDO rear end collisions to outweigh a couple of more serious injury collisions. So when you're looking at the frequency of crashes and things like that, take that into consideration. So I'm only looking at K, A, and B type crashes, fatalities, serious injury, minor injury type crashes. So I've got that set up in my filter. And then it generates me a list of locations or a list of half mile road segments throughout my area in this sliding window analysis. The next part of this is, and I don't know if you can see if I'd float my cursor over this or not. I don't guess so. But
Yeah, we can see it, Dave.
okay, but what's important here is what I rank by is this is straight out of the Highway Safety Manual. The EPDO is straight out of this formula, straight out of the Highway Safety Manual. And this is what I like to use. Now, this is just a personal thing. It does not mean y'all have to follow this. You can use crash rate, number of crashes, number of fatality crashes, whatever sorting criteria you would like to use. But this is one of the great pieces of sliding windows, is it allows you to pick your method of scoring and sorting. And by sorting by EPDO, it also gives me a little insight. The higher that EPDO rank score is, the more likely I'm going to have a really solid benefit cost. Remember, I go back to that first part of our conversation where we want to have our projects within each one of our project groups have to compete with one another. So I want a high scoring project from a benefit cost perspective so it can compete with the other projects that are currently scored up. After I've selected that, the next thing that I like to do is I like to go to Crash Query. I really love Crash Query. I do this for my initial screening. I've selected an area, but then Crash Query gives me a little bit different perspective, because then I get to drill into all my crashes. So by just simply looking at, by simply pulling the route identification and mile points, I can very easily go into Crash Query, filter in the route ID and the mile beginning and the mile point, and I pull all the crashes. And then I can consider all the crash types that are occurring on that corridor. I can use the sidebar to help filter and speed filter. For those that haven't used the application, or those that have used the application, you can pretty much readily see that there's a lot of information being presented to you here. I was thinking about doing this live, but I knew I'd get trapped and we'd be talking about just one query forever. But there's a ton of information that's accessible through Crash Query. And it allows a user to really dig in. And what's even better is you can start studying what's going on with your pedestrian crashes. You can look at what's going on with your bicycle crashes by simply filtering by pedestrian and filtering by bicycle. You can see what the outcomes of those crashes are. And by the way, 15 pedestrian crashes in a half-mile section. I don't know about in your states and your communities. That's a pretty high frequency. Remember, we started this by just filtering based upon social vulnerability index. This is a perfect example of why social vulnerability index is a great indicator of vulnerable road user expectancy for crashes involving those type of users. And as we see, we got 15 pedestrian crashes in this section. We've got 4. So we've got 20 vulnerable road users in this half-mile section that have been involved in crashes, and not very encouraging. But it's an encouraging from the regard of social vulnerability index is a good indicator. Again, consider your crash severity. Save this information. What's really nice about this, you can easily save, you can easily share this information with other users that you want to draw into the conversation so you can expand on that conversation. The next thing that I ask you to leverage on is using charts and graphs and tables, and also producing your reports. You can simply do a pivot table really fast, not a collision with a motor vehicle. There's your 5 fatalities in this section. Every one of them was a pedestrian, by the way. We've also got 6 suspected serious injuries. Some of those are also pedestrians. So we see that really showing up in this section. We can build pivot tables, we can build charts, and of course the table, the report that you can generate from the crash query. Very easy to produce that, save down, share these tables, share these charts. Very easy. You can print them, share them however you need to. So crash query is a great way to get conversation and continue the conversation downstream if you're trying to share information to get more people involved and basically encourage others to support your project ideas and your program ideas, or to get more action. So do we go to a TE study from this, or do we go to an RSA from this? Those type of things can be generated and those conversations can be held. The next thing, to get a good idea of what's going on and what you might be expecting, is safety analyst. Now, I don't know how many, now safety analyst, you might be a numeric user, but even fewer people use safety analyst. I'm gonna have to get a drink of water. Safety analyst takes that exact same location and allows users to go in and select treatments and do estimated price cost to generate a project BC. What I really like about safety analyst is if you see treatments that are not having a positive impact on the project area, you can eliminate them from your list by simply hitting the trash can, and that will be dropped from your list. Your benefit cost will be recalculated. Might be something you need to do to make it more competitive. But safety analyst is a great tool to give you insight to say, wait a second, this project is really going to be great and be able to compete with other projects on my list if you want to just go that route. Now, of course, if it's systemic, maybe you don't need to do that. Or if you just want to do a road safety audit, maybe you don't need to go this route. But if you wanted to compete with other projects on your list, excuse me, you might want to take a look at your safety analyst and calculate your benefit cost to see how it may compete with other projects. I apologize for that. I've been fighting a cold, and another tool that I would like to introduce you to is using SVI as a way of looking at network screening of intersections. We've just started getting network screening intersections up and running, but SVI has also been a great tool for looking at intersections. And it's really works in very much the same way. You just basically, instead of going into sliding windows, you're going to use network screening for intersections. And in this specific example, we're looking at the entire district. We've picked an entire district. And then what we've done is we've taken our SVIs of the same range, basically 0.8 up to 1. But then we've added one additional piece. We want to make sure there's been pedestrian crashes at that intersection. Man, I'm killing y'all. So adding the pedestrian filter for pedestrian crashes gave us a shorter list to consider. I'm going to have to pause. I apologize for that. Hold on one second.
You're good, Dave. Take your time. So while Dave's recovering, I see that several of you have dropped questions in the Q&A panel. Keep them coming; those are great. We've flagged a lot of these questions to circle back and answer during the Q&A period. So I'd encourage you to keep dropping those in there. We've got some good ones in there so far.
I apologize, folks. Thanks for bearing with me. So basically following that same sort of a logic that we did with sliding windows, we're able to do this with network screening intersections. Now in the state of Georgia, what we did is we went through a process to define intersection footprints based upon various factors. Your approach might be completely different, but we use things like functional class, which, by the way, if you go back to Jerry's slides, he said functional class was one of the criteria. Also route ownership, the cross-section number of lanes, also ADT. And so that's how we came up with the footprints for the intersections. So very much in line with what Jerry had alluded to, SVI, network screening intersections, we've got all that baked in sort of in the background. You don't see it in the foreground, but it's in the background. But when we have two intersections or multiple intersections, they're within close proximity to one another, and those footprints overlapped, we basically said this is because of proximity, we're just going to call this one intersection. So I noticed when you're looking at this intersection, it's very, very easy to go, wait a second, that's more than one intersection. You got 3 approaches on one, and then you got, looks like 6 approaches. They're so close together, we just meld those into a single intersection because of that proximity. So don't think anything's messed up here. That's intentional. So once we define that intersection, it's basically the same process. What we're going to do is we're going to look at that. We're going to look at the crashes. But what also I want to point out that we didn't touch on in the previous slides. Whoops, am I frozen? There we go. Is aerial photography. And I know everybody on the phone uses aerial photography quite extensively, but what this gives us is a quick peek and a quick glimpse into this intersection and gives you and you see that obviously we've got a continuous left turn lane. We have 0 pedestrian accommodations out there. So it's a great project location for pedestrian countermeasures. I don't know if I'm making it through this, guys. And so that's a no-brainer. Great location. Great opportunity to improve safety for all users. I apologize. I'm just falling apart.
Hey, Dave.
Yeah.
If you're okay, I hate to keep pushing. I know you're sick. I know you're losing your voice.
That's okay. I'm gonna get through it. I'm almost to the end. Just give me a second.
Okay, you're good.
So that's the basic tools. But what I also want to touch on is dashboards. And I worked with the Numetric team to do this. And I really want to brag on this because actually we worked with Jerry, we worked with Numetric, and we worked with our team here. And we created a local road safety action plan dashboard, which really supports a lot of what Jerry was alluding to previously. This is a dashboard. This is for local governments so they can jump in. One of the things that I do want to point out is this bottom box right here, or this sidebar. We've got metrics or filters that can be easily applied, whether you want to do an MPO, whether a city or county, whether various ownerships of the roadways or various crash types. But also on the sidebar, users can apply the social vulnerability index and drill down on that as well. It's very easy. It's simple to do the filtering. It's quick. It doesn't take much training. It supports both local road safety planning and it supports Safe Streets for All program. So they helped. We worked together in concert to create this dashboard. Once you put your filters in, you get a quick list of roads, a quick list of intersections. Very easy. All you got to do is download this. You can download these. You can rearrange the columns. You can do whatever you want to. You can rank by whatever. Very much like we saw with network screening and intersections and sliding windows. You can sort by whatever measure you want. The way ours is set up is it's sorted by EPDO. So it's very easy to just download those, share those with users, put together whatever. If you want to put together a local road safety plan, they're very easy just to download. They come in Excel, just add those an attachment into your plan. Also part of this dashboard is links to important data. Whether you're wanting to get more information about Safe Streets for All, the local road safety plan from FHWA, the proven countermeasures are in there. We have an ICE tool, which we're very proud of in the state of Georgia, the intersection control evaluation tool. You can download all that data. You can get access to that data. But also what's really nice up in this top corner, if you'll notice, it says, if you'll notice this drop down, in this drop down, we have an option to go to specific pages. Each one of these pages within this dashboard are applicable to our emphasis areas within our SHSP. So if it's whether it's aggressive driving, distracted driving, age-related issues, any of those things that are part of our SHSP, you can go into one of these tabs. There's maps, there's graphs, there's pivot tables, there's a ton of information. All that information is easy to download and attach and add to your plan, and makes it very accessible and usable and shareable to promote your plan ideas, what you want to accomplish. So I really do apologize that my throat fell apart on everybody today. Hopefully you'll forgive me for that. I'm sorry I sort of had to rush through this last section, but if you ever have any questions about what we've done, how we've put the social vulnerability index into Numetric, and how we're thinking we're going to get very positive returns as it comes to our vulnerable road user planning and project assessment and project generation, just let me know. I apologize, guys. Thank you.
Thank you, Dave. No need to apologize. Hopefully you get feeling better here soon. Thank you for walking through that information and running us through your presentation. And thanks again, Jerry, as well for your time. Thank you, everyone, for sitting in on the presentation this far. I know we had a couple people who had to drop off at the hour, but we are going to stick around now and turn into the Q&A session. So if you need to hop off now, thank you so much for your time and your participation. We will be sending a recording of this webinar off. We usually send the recording to the webinar off a couple days after the webinar took place. So look forward to that coming your way as well. Dave, we got a couple questions for you, but I'm going to give you a second to let your voice recover, and we'll kick the first one over here to Jerry so that he can spell you for a bit. So. Jerry, we had a question come in. Let me see if I can open it up here. Find the right window. So the question came in, is there any federal grant for collecting data and improving data inventory and asset management related to vulnerable roadway users? So for example, active transportation asset collection, bike lanes, sidewalks, ADA ramps, all that.
Yeah, great question. And I guess I'll mention too, great job, Dave. It's amazing to see what GDOT is already doing. I've had a chance to work with Dave over at least 3 or 4 or 5 years now, I think, and it's just really impressive on how they're turning data into information for their host of users throughout the state. So kudos to Dave and what they're doing. Not just using the SCDI for their pedestrian or their VRU safety analysis, but using it really for any of their analysis. So really encouraging to see that. So, but yes. So as far as funding grants, federal grants, the HSIP program, the Highway Safety Improvement Program, does allow to use a portion of those funds to collect information like that. So there could also be additional grants. I've kicked that question over to our HSIP program, our Highway Safety Improvement Program team. And so I may have to follow up with you offline on that just to give you a full range or full answer on that. Greg, I can send that through you or directly to the person too. So I'll let you know when I get back. If I do see something that comes in the next few minutes, I can pass it on to as well. So I do want to acknowledge Ida Van Skolvik from Washington State DOT. She did send me a note that said that the guidance states, however, states may consider more years of data. So 10 years of data apparently is fine. So I appreciate Ida pointing that out to me. So kudos to her. So
thanks, Jerry.
You bet.
We had another question come through regarding EPDO, the performance measure that Dave was using on his network screening analysis. And the question was, trying to learn more about EPDO. They were essentially just asking what that calculation is. So we do have that documented in our calculations overview. Let me share my screen here really quick, and I'll walk you through that. That is found on our support website, which is support.newmetric.com. From there, you can click on the transportation apps. And then it's just this first article right here, calculations overview. Essentially here, we're going to document all of the calculations that we use for all of our performance measures, all of our network screening calculations and so forth. So if we go here to equivalent property damage only, that fun little formula there explains essentially the weight of each of the different severities of the crashes. So this is based off your crash costs, your agency specific crash costs associated with each of those severities. And what we do is essentially just proportionally distribute a weight according to the difference in those crash costs. So what you're doing here is saying, how many property damage only crashes would it take to have the same weight as a fatal crash? So depending on what your agency's severity ratings are, it could be something like you'd need 197 property damage only crashes to have the same weight as a fatal or a K injury crash. So that's kind of a simplified breakdown of it. Like I said, we've got a lot more complete documentation on our website here that actually runs you through that full calculation, but it does not necessarily take the length of the roadway or any of those other roadway characteristics into consideration. It's kind of done more through the screening methodology. This is simply just the value, looking at the crashes in that study area and giving you that EPDO ranking. So hopefully that answers that question as well. And again, you can get here just by going to support.newmetric.com and you can look up that calculations article. So, all right, Dave, you ready for a question? All right, we got a thumbs up. So Will asked, how much weighting are you giving to the crash data and how much to SVI? So are you estimating the vulnerable roadway user demand in the area or on the roadway characteristics? And you kind of talked about that a little bit. You're still kind of in the early stages of figuring out that weighting. But I don't know if there's kind of any more insight you want to share around how you guys are thinking about approaching that now. Or if there's anything else you wanted to kind of share on that.
Yeah, we're still scratching into that, Will. It's a reasonable question to ask. It's As you go throughout the state of Georgia, or probably, you're in Tennessee, I think, isn't that correct? I believe that's correct, Will. That varies as you go throughout your state. You got some areas that have very high concentration of crashes, and then you got other areas, low concentration of crashes, and how you weight and compare those and how you want to consider those. Now, typically speaking, we're really using right now, all I can say for sure we're using SVI for is when we're selecting road safety audit locations. It really has added it's been a great benefit for us, especially when we're considering wanting to do select those locations across the state, because we want to make sure that we're doing locations that have a broad cross section of crash types and things like that. And we want to try to take out as much of that human bias. It's bad to say human bias, but it does exist. And just using a data-driven approach to identifying those locations and letting the data just tell us where to go. And right now it's, do we use from point 8 up, or do we use from 0.7 up or 0.6 up? The research basically said anything from about a 0.7. I'm just more conservative with my estimates, saying, 0.8 up, because that way I just have a higher confidence level. That's me personally, but that's not. But I would just suggest, Will, if you dig into that and just look at just start doing your research to see if it works for your state. If it doesn't, it doesn't. I mean, I'm not sitting here saying it's going to work for every state. I think Jerry's presentation, he pointed out multiple sources of resources to try to get information, and SVI might not be what works for you, but I just found that it'd be for a quick turn. I found it was just so easy to use, and there was so much work that already went into it. And it is a great product from the CDC. That's all I could say. I mean, it's been around for a number of years. It's proven. It's been validated. There's several research papers that have been done to support it. But now, of course, it's all been for emergency response. It's not been for identifying vulnerable road users and stuff like that. It just worked, and we found a great correlation, and hopefully it works out for you. If it doesn't, unfortunately, I can't guarantee that it will for Tennessee. So, and how you would weight that for Tennessee versus how it might be weighted in Georgia, I don't know.
No, thanks, Dave. Great response. And I think Danny and I were actually commenting in your presentation that correlation that you all have uncovered between SVI and the vulnerable roadway users. I mean, that's just, it's phenomenal. I can only speak anecdotally, right, from the few that we've run and actually looked up, but there seems to be a really strong correlation between that data. And like you said, the barrier to entry to using that SVI data is so low. It's available, it's solid, it's on a very small geographic resolution. It's really a phenomenal resource that y'all have uncovered. Jerry, go for it, add something.
Yeah, I was going to add just a little bit. I see some Will's other questions, and I think you make some great points. But the other thing that I think is very beneficial to SVI is it identifies those areas. We certainly know, in parts of the country where crash data may be underreported, right? Someone gets injured, they don't trust the government, they don't trust law enforcement, and so they take off or whatever. Maybe you get that through a hospital record or something like that, but there might not actually be a crash report that gets generated. And so again, that's another reason to work with the consultation, to work out with some of those other groups. You may find out a whole bunch of crashes that just aren't reported in your database, and so the SVI can help with that too. So, but great thoughts.
Yeah, Jerry, I'll piggyback on that comment. A lot of times impaired pedestrians will not stick, or I mean, if they're not seriously hurt, if they can get up and run, they will try to leave the scene of that crash.
Yeah. Oh, great. Great insight. So we did have one more question. Well, not one more. We got a question that came in from Don over in Nebraska. Hi, Don. Says, are the Georgia DOT dashboards publicly available? And can public users search by SVI?
Okay. We've got to check with our overall dashboard, but as far as the dashboard that I showed you, that dashboard was specifically built for our local governments and our MPOs to utilize. So they have to come through us to gain permission to use that dashboard. But we do have a public facing dashboard, but I don't know if I don't think we have placed SVI on that dashboard yet.
It, Danny is looking here right now, and it is. So
It is? Okay.
Yep.
Well,
Yeah.
well, thank you, Danny.
He's always here to bail me out of the difficult stuff. So awesome. Great question, Don. And just a really quick brag on Dave and his team with their dashboards. They have done such an amazing job of sharing that data publicly. Not just with agencies and local, roadway owners, but also with the public. And it is just, it's something that we call out a lot, and a lot of states see and model their data sharing after what Dave and his team have done with Georgia. So you guys have done a great job with making that data available, and not just available, accessible, easy for people to understand and use and extract that information from. So great job, Dave.
That's something you use with your driver's ed instructors, right? In schools, right? So that's incredible. I think we spend so much as agencies collecting data, and then we try to use it for just one purpose. And so the more we can make that available and turn it into information, knowledge is power, right? So
yeah,
kudos to you guys.
Yeah, good work, Dave. All right, so we got a couple more questions here. We talked about EPDO. Will had a few more questions here. So this kind of cycles back a little bit to talking about the years of data. Will ask, how many years are you using, and are you including in your freeway slash interstates for your your VRU crashes? I can't read today, apparently. So
now
go for it, sorry.
Yeah, so that's going to be a personal choice between the states or the users of whether you include interstates and freeways. What we typically, I will say this, I've seen it on, maybe in Texas or something, they definitely want to include it because they've got a lot of migrant workers or things like that. I don't know if that's the correct way to say that, but they're, oftentimes running across the freeways and things like that. So I can see a state or a location like that definitely wanting to include pedestrian and vulnerable road users in those situations. The state of Georgia makes a relatively sound effort. All law enforcement officials make a pretty sound effort keeping vulnerable roadway users off the interstate. What we typically have on our interstate system is a post-crash or repair type situations where we've got those vulnerable roadway users being struck in those environments. Me personally, from a project planning perspective, I work closely with our messaging and with our behavioral side of the house, and we try to do messaging to try to address that. But I don't see much we can do from an engineering perspective. At least maybe that's just my limited knowledge or experience. So when I'm considering project level planning and things like that, I currently don't include interstates and freeways when considering vulnerable roadway users. That's just me. That does not mean you should not. I mean, no way in. I don't even tell my engineering teams not to include that. That's just me. That's when I'm doing my screenings and things like that. When it comes to vulnerable roadway users, I don't include interstates and freeways.
No.
Yeah, I would say that's probably where most states are going to end up. I mean, I'm probably making a projection. I shouldn't, but I think you're key. I think too, you probably already do some engineering strategies. You maybe already have rumble strips on some of those freeway systems. You're already using dynamic message signs to tell them that there's a vehicle broke down ahead or whatever. So You might be doing those things. It just depends on the state. Some states that are more rural in nature, that might be where they have a higher percentage of their pedestrian fatalities versus, urban areas or something like that. So, but
Right.
yep, something to look at. But we expect that to be tailored to what the data shows you, right? Data-driven approach. So,
Yeah, we actually had five pedestrians killed in one interstate crash, and it was a post-crash scenario. They were all outside their vehicles, and it's just so we went through a whole messaging campaign to try to inform drivers. We reached out to news media to make sure they understand that they messaged that on our behalf and things like that. So we did more of a behavioral type countermeasure as opposed to an engineering type of approach.
Awesome. Well, thanks, Dave, for sharing that. One more, not a question, but a more of a comment, and then I think we'll go ahead and wrap up from there. But Ida said in Washington State that they also found the same correlation with the crashes where the VRU fatalities or serious injuries occurred. So, again, that correlation between the SVI data, the vulnerable roadway user data, and we've heard from several other agencies and other kind of industry, engineering groups and things like that, there appears to be a pretty good correlation, a pretty strong correlation between that SVI data and the vulnerable roadway user injuries. So, always good to hear from everyone sharing their expertise and their experiences on here as well. So, well, thank you so much, Jerry, Dave. As always, thank you guys for sharing your time with us and for coming out here and sharing your experiences and being open to questions from everyone. You guys are always have great information to share, and everyone always loves sharing your experiences. And thank you to everyone who was able to attend the webinar today as well. I know a few of you stuck around for the question and answer. This is always my favorite part. We get some great discussion. So thanks for hanging in there. We will be sharing, like I said, the recording of this webinar out within the next couple days. So keep your eyes peeled for that as well. There's a couple more questions in the Q&A. We will be responding to those ones offline. So look for an email coming out from us in response to those ones. So thank you all so much. Ryan, I don't know if there's anything else from the AASHTO side before we wrap up, but yeah, we'll go ahead and kick it back over to you. You're on mute, sorry.
You think we've been doing webinars long enough that I know how to use Zoom, but no, thank you everyone. I appreciate it. I know we're at about the 90-minute mark, so I really appreciate everyone taking the time today. Like Greg said, the recording will come out. I think Jerry had sent me some slides already, so we'll be distributing those to everyone as well. I think that was one of the questions. So we'll make sure the slides are distributed as well. If anyone has any questions, you'll be getting a final email after the registration. It'll have my contact information, so feel free to reach out. With that, thank you everyone. Have a great rest of your week. Bye.
Thanks everyone.